Hi everyone, it's Brian, and typically my role revolves around numbers, planning, and money, but today I'd like to speak to something a little bit more health orientated, and that's your mobility health with Dr. Sasha Green. She is a chiropractor and owner of the Chiropractic and Health Associates Clinic at Yonge and St. Clair here in Toronto. Unbelievably, she's been a chiropractor for 20 years, and at her clinic here they have a massage therapist, they have an osteopath, they have a psychotherapist, they have traditional Chinese medicine, they have acupuncture, and they put together custom orthotics for people. So Sasha, thank you so much for being here today. I appreciate you taking the time.
Thank you for having me. I appreciate you being at my office.
As we get past the age of 20, I think we can all agree that our bodies start to change with age, and that can escalate as we get into our 40s, 50s, and 60s. And I was just wondering if you could highlight a little bit of the changes that occur as we go through this period. What are the changes that happen to us?
Absolutely. I would say probably, and obviously, a lot of the more common things that I see coming into my practice with an aging body are mobility issues and flexibility issues. And in part, that's just the natural decline as we get older. I think a lot of it's preventable, but it is the natural decline and can have something to do with our genetics as we age. But there's also that element of being in careers for 45 plus years and the inactivity that comes along with that, sitting at a desk for 45 years or more. And even though we think we're being active, it might not be enough to overcompensate for the numbers of hours that we spend sitting at a desk. So that's kind of the first general area, obviously, where I see changes. The second area would be more in balance or someone's vestibular system. That, as part of the nervous system, will degenerate as well. And that can show as overt signs such as dizziness or vertigo. Sometimes people might just in general feel like they're losing their balance, or maybe they've been labeled as clumsy because they're slipping and falling more frequently. Sometimes it's imperceptible, but someone just feels like they're a little bit off. And those are usually warning signs, and you should listen to your body and tap into those warning signs. And then the third major area that people often don't think of is their visual system. And by vision, I don't necessarily mean acuity and how well we can see, but I mean sometimes there are ocular muscle changes, that the eyes aren't tracking as well as they used to, or there's weaknesses in those muscles. And a lot of people don't recognize how intertwined those three systems are: the eyes, the spine, and that vestibular or balance system. And because they're all interconnected, a breakdown in one will contribute to a breakdown in all three. And then you create this vicious circle of postural decline. And as the posture declines, the muscles start to become painful, the joints degenerate further, and all those things are preventable and correctable if you know what you're looking for.
So Sasha, that's interesting. That naturally kind of flows into my second question of these changes to your muscles, to your spine, to your balance. How does this impact people's lives, like on the ground, the day-to-day, the hour-to-hour?
Quite significantly, actually, especially as we age. It's not just the pain and the mental emotional component or impact that it has. That can also have a mental and emotional impact on our family members, because now they have to help care for us, or they're taking on additional roles in the family that you can no longer contribute to. But even if you're not in pain and you're just not functioning properly, again, it's those day-to-day things, like no longer being able to enjoy your recreational activities. Maybe you want to pick up your children, your grandchildren, play with your grandchildren, and that's too painful, or you don't have the right kind of function to be able to, or longevity to be able to perform those activities anymore. And then that starts to bleed into the financial a little bit. Maybe you still have to work. Maybe you want to continue working because you enjoy it, but you don't have the stamina to sit at a desk for that long because it's impeding with your comfort and your focus. It's making you depressed and irritable. And then there's the financial impact of treatment, whether that's paying out of pocket for manual therapies, such as what I do or the other practitioners in my clinic, But it's also maybe the financial impact of having to go to a medical doctor and getting prescriptions or over-the-counter medications. And I often say to my patients, you don't have pain because there's a deficiency of Advil in your bloodstream. So let's get to the root cause of why this isn't functioning properly or why you're in pain and cut it off at the source.
So, supposing that somebody's not in a very drastic state at the moment, how would you recommend kind of delaying this, pushing this as far as we can into the future, and avoiding these symptoms that inevitably we're probably all going to face?
Yes, and I always say prevention is key, and people usually say to me, well, it's too late to start, and it's not. But that could be simple techniques as improving nutrition, nutritional strategies. There are a lot of supplements out there, natural alternatives to assisting with muscle repair, bone and joint supplementation, combating inflammatory responses. Hydration is critical. The more you keep yourself hydrated, and the guideline is about half your body weight in ounces per day, and if you keep hydrated, your tissues are going to respond more effectively, not only in general as you go through life, but also to treatment. They respond much more effectively to treatment if they're well hydrated. Then there's exercise, and you can look at that twofold. Don't underestimate the power of a 20 to 30 minute brisk walk. From a body fat burning perspective, the research shows that 1 pound of body weight lost is the equivalent to 5 pounds of pressure on a knee joint. Imagine the implication of only losing 10 pounds of your body pressure from 2 pounds of body weight on someone who wants to continue to enjoy running and slow down the progression of the osteoarthritis. The movement is also important for restoring those neural connections to the brain. You don't want to be doing those same route exercises and movements all the time. If you can give the body new and complex movement patterns, you challenge the brain. You remind the brain that that body part exists, and when you restore those neural connections, you restore function. When you restore function, you decrease pain. And then, of course, there's chiropractic for prevention, which is obviously what I do. And if we go back to those 3 systems that we discussed at the beginning, the spine, the vestibular balance system, the visual system, you can very easily assess where the breakdown is in that neural loop and provide very specific treatment and exercises that people can do to restore their function, often more quickly than you would expect once you get the right structures.
So, a lot of the basics that we hear a lot about, which are difficult sometimes to incorporate into our habits. So we've got nutrition, hydration,
Yes.
exercise,
If you don't use it, you lose it.
and not doing the same bench presses that we've been doing for the last 40 years.
Exactly.
Do different things, and a chiropractic treatment or alternative therapies to keep things
To
moving.
stimulate that nervous system and get things moving, restore those connections.
So I think you mentioned a little bit before about, it's too late and people don't want to get going. Is it too late? I mean, is there a point where you just put up your hands and say, well, this is my life?
That's it, I'm old.
And just
No.
kind of say, well, that's my knee and that's how it's going to go?
Absolutely not. In some extreme cases, you're not going to make a huge dent. And I have to be honest about that. If you've got somebody who's quite elderly with chronic severe degenerative issues, we can help. We can improve the quality of life, but you're not going to get it to 100% pain-free, but you can restore enough function and quality of life and reduce the pain that it makes it a lot more manageable. But in those general cases, it is quite akin to going to the gym. And I like people to understand that just like going to the gym, you can't go once or twice and get a really nice toned bicep. It's frequency over time. So if you approach your treatment and your movement patterns and your home exercises in that capacity, it's very possible to make a big dent in something that seems insurmountable. And I've shared the case with you before, and I'll share it again, of an elderly woman. I use the word elderly lightly. She's about 80 years old, and she's come in to see me quite recently because she had a hip replacement surgery that was botched. So she's had 3 surgeries to try and correct this problem. So you can imagine the degeneration in her muscular tissue and the scar tissue and the weakness and the pain after months of going through this and weeks of physiotherapy. She doesn't feel like she's making any gains. So in about 4 visits, we've been able to restore about 80% of her range of motion and also a significant reduction in her pain level so that she's able to weight bear. And that now gives her the ability to be able to perform the rehabilitative exercises that she needs to do. But at least there's light at the end of the tunnel. And this was all done without even doing any spinal adjustments because she's way too delicate for that. It's just some really targeted exercises and treatment techniques by determining which muscles are the weakest and not supporting her properly, and using some technology in order to eradicate the pain and the inflammation. And it's incredible how far you can come in 4 visits, and just to see the smile on her face now when she comes in after months of battling this. I mean, it's why I do what I do.
Quality of life just went.
I love it. Exponential growth in just a couple of weeks. It's incredible.
So people need to alter their headspace a little bit, habits, some time, but also with coming here to the clinic, there's a little bit of budget.
Absolutely.
And you know, somewhere we'll all come in to help you plan for that. But from a maintenance standpoint, from a non-dental, from a non-medication standpoint, kind of what's the dollar amount, like monthly, that could keep somebody on a preventative maintenance order?
If all someone is interested in is maintenance and prevention, and you can sum that up to something as simple as 1 massage a month and 1 chiropractic treatment a month, you could budget around $160 to $170, and that would keep you in the maintenance category and keep you functioning as optimally as possible.
So doing all those things, the ability to walk, quality of life for not that much money and a pretty mild commitment.
Exactly.
Sasha, thank you so much for your insights and your time. I really appreciate it. It's been wonderful.
Thank you so much for coming. I loved having you.
Great.
Thank you.